I think somebody was talking about the amount of time physicians spend documenting, 45% of their time just in documentation. I would argue that the therapists are spending more than that sometimes. So to have a system like NetHealth that can decrease that for them, and they can spend less time at a computer. They don't like computers. We all went into therapy because we're people. We want to touch our patients. We want to work with them. We want to be in the gym doing stuff. We don't want to be sitting at a computer not able to interact with our patients. Whatever we can give them to get them away from the computer for more amounts of time, they might actually see more patients and be busier through the day, but they're going to finish their day with much less fatigue and burnout because it was a good day. Like you said, that's what they want to be doing. They want to be out there, they're treating. And so if I can give them that good day, that's what they want.